So there are many foods and beverages that all of us consume that are not particularly good for our health. So it's a fair question to ask, why are we specifically targeting sugary drinks? And the simple answer is that sugar-sweetened beverages are the largest source of added sugar in the American diet, far more than desserts and candy combined. And furthermore, many studies show that sugary beverages are a significant contributor to obesity, to type 2 diabetes, to heart disease, and poor oral health. Consider these alarming statistics. About 60% of students at all grade levels in Massachusetts drink at least one sugary drink every day. The American Heart Association recommends that children consume no more than 1 8-ounce sugary drink per week. Thus, many of our children are consuming as much as 10 times the recommended limit on consumption of sugar-sweetened beverages. Poor and minority children in our communities are at particular risk of over-consuming sugary drinks, with black children, on average, seeing twice as many soda ads every day as white children do. Sugary drinks offer no nutritional value, unlike, say, milk or 100% fruit juice. And sugary drinks are usually consumed in addition to, not in place of, solid calories, which is why they are such a significant contributor to weight gain. Approximately 16% of ninth graders and 60% of all adults in Massachusetts today are either overweight or obese. And approximately 7% of Massachusetts residents suffer from diabetes, a rate that has more than doubled over the past 20 years. And it is estimated that about 35% of our adult population is pre-diabetic. The healthcare costs to treat these obesity-related conditions, type 2 diabetes, and heart disease easily exceed $500 billion annually in the United States, and certainly here in Massachusetts, many billions of dollars. And this is a burden that is borne by all of us who pay healthcare premiums and all of us who pay taxes. To help address this public health crisis, Representative Khan and I have filed new legislation this session, which is titled An Act to Promote Healthy Alternatives to Sugary Drinks. The goal of this legislation is to reduce the consumption of sugary drinks, replacing it with water and other healthier beverage choices, particularly among children and teenagers. This will improve health, lower rates of preventable chronic diseases, and reduce healthcare costs over time. What could be more important goals than that? This legislation establishes a tiered sugary drink excise tax. Beverages with less than 5 grams of added sugar, so this is not naturally occurring sugar, this is added sugar, with less than 5 grams of added sugar per 12 fluid ounces would not be taxed at all under this proposal. Beverages with between 5 grams and 19 grams of added sugar per 12 fluid ounces would be taxed at a rate of 1 cent per ounce. And beverages with the most added sugar, 20 or more grams per 12 fluid ounces, would be taxed at a rate of 2 cents per ounce. It is estimated by the Harvard School of Public Health, who looked at this proposal, that it could raise approximately $368 million annually here in Massachusetts. And this bill proposes that all of those proceeds, 100% of the proceeds, would be deposited in a newly established Children's Health Promotion Fund. The state's Department of Public Health would administer this fund, and they would have the authority to expend this money in a number of different areas where we can improve children's health and wellness, particularly in our most vulnerable and disadvantaged communities. So this could, for example, improve expanding the state's Mass in Motion program, supporting the Prevention and Wellness Trust Fund, providing grants to municipalities and schools to install safe and convenient drinking water fountains in schools and parks and playgrounds, promoting nutrition programs for preschools and childcare facilities that serve low-income communities, as well as supporting other evidence-based methods for improving our children's health and wellness. Early results from several other jurisdictions that have implemented excise taxes on sugar-sweetened beverages are very promising. For example, the city of Berkeley, California implemented a 1 cent per ounce tax in 2015, and consumption of sugary drinks fell by 21% in low-income neighborhoods in that city within the first 4 months. And at the same time, water consumption increased by 63% compared to other cities that did not impose a similar excise tax. The Urban Institute completed an analysis of sugar-sweetened beverage excise taxes just last year, and they estimated that a 2-tiered tax, where the amount of the tax is based on the actual sugar content in the beverage, like proposed in our legislation, could reduce overall sugar consumption in beverages by as much as 20 to 25%. We have an incredible coalition that has come together to advocate for the passage of this legislation, and I want to thank these forward-thinking organizations, many of whom have joined us in the briefing today. They include Boston Children's Hospital, the Joslin Diabetes Center, the Boston Foundation, the Boston University School of Public Health, the Massachusetts Dental Society, the Massachusetts Health Council, the American Heart Association, the American Diabetes Association, the Reebok Foundation, and the Massachusetts Health and Hospital Association. Thank you very much. And now I would like to introduce our first speaker, who is from Boston Children's Hospital, and we're very pleased and privileged to have with us Dr. David Ludwig, the director of the New Balance Foundation Obesity Prevention Center. Dr. Ludwig. Thank you.
Honored to represent Children's Hospital today in support of a tax on sugar-sweetened beverages. And as an academic, I feel it's important to have what's called equipoise. So keep an open mind. So in addressing this question, I sought potentially positive health benefits of sugar-sweetened beverages, and I came across this. This was the only positive benefit I could find. It was this claim that it had clinically superior hydration benefit compared to water. And I was very interested in the source of this claim, and it turned out to be Kraft Foods. Other than that, I was unable to find a single health benefit of sugar-sweetened beverages for public health in the US population. Contrast that to this range of potential adverse health effects: a negative impact on diet quality, obesity, which we'll focus on today, type 2 diabetes, cardiovascular disease risk, gout, osteoporosis, of course, dental cavities, and potentially even cancer. But focusing on obesity, what is the evidence? Well, it really falls into 4 categories. One is sort of just common sense. How could sugary beverages actually have an adverse effect on body weight? Second, observational studies that are done cross-sectionally. Third, a stronger study, prospective observational studies, and then the granddaddy of them all, clinical trials. And I'll just make a quick comment about some of the sources of potential variability in the literature. So in terms of mechanisms, why would sugary beverages have a special problem? Well, these ideas have been postulated. First is passive consumption of calories by drinking sugary beverages. In other words, a child, or anybody for that matter, might be thirsty and their body needs water, but when they're drinking a sugary beverage, all of those sugary calories go along for the ride. They get introduced. You're not eating out of hunger, as we would with most other foods, and they get introduced and they shift calorie balance positively. And that could also happen not just for thirst, but for social reasons. You know, you're at a party, you're at the playground, the other kids are drinking sugary beverages, it's cool, and so you do it too. You might not be thirsty, you might not be hungry, but again, you're getting the effects of these things passively. Second is that research seems to suggest that liquid calories slip underneath the body weight regulating radar system in a way that solid calories don't. And third is the ultra-fast digestion, not just of sugar, but sugar alone, pure sugar in liquid solution. So in this study, we gave our research subjects basically 2 sugary drinks, or 2, I should say, carbohydrate-containing drinks in the form of milkshakes. One was, the carbohydrate was sugar, and the other, it was a slow-digesting starch. And as you can see in the dark squares, blood sugar surged after that sugary drink, but then crashed a few hours later compared to the other drink. And a few hours later, people, despite getting the same calories, reported greater hunger after that sugary beverage. And now, I'm going to show you what actually happens in the brain. We did brain imaging with a fancy technique called functional magnetic resonance imaging. So this actually shows brain activity. It shows what parts of the brain lit up. Well, it's one thing to be hungry, but the area that lit up here is called the nucleus accumbens. It lit up like a laser, very strong signal, after that sugary drink. And that area, the nucleus accumbens, is considered ground zero for the classic addictions of cocaine, heroin, alcoholism, raising a provocative notion that these highly processed carbohydrates and concentrated sugars are hijacking basic pleasure and reward systems. It's one thing to be hungry, but if your addiction center kicks in, it's game over. You know, your likelihood of resisting more temptations is going to be very low. In terms of the actual data, this is a cross-sectional study done from the Continuing Survey of Food Intake by individuals, a national study. They found that sugary consumers, children, sugary beverage consumers, on average, consumed about 18 calories a day compared to non-consumers who consumed 1830 calories a day. But these cross-sectional studies are kind of weak. It's harder to tell cause and effect. So we also have to look at these prospective studies that follow people over time. Our group conducted one of the first, and we found that this was based in Cambridge, about 500 middle school children over a 19-month period, that for every additional serving of sugar-sweetened beverages a day, taking into account other factors controlling them, like socioeconomics and other things people are eating, that one additional sugary beverage a day increased that child's risk of obesity over these 19 months by 60%. You know, that's a huge effect. And we're seeing that signal in other studies. This was a one-year study of 10,000 children ages just 2 to 3. I mean, amazingly, there's enough sugary beverage consumption among these young kids that we can actually do this sort of a study and see these young children who were drinking sugary beverages had twice the likelihood of becoming or remaining obese. Finally is the randomized controlled trials. And in 2 studies published in the New England Journal of Medicine, one by our group and one by a group from Holland. This is the Holland study. What they did was, in effect, a double-blind study. They hooked up with actually a beverage company, and they created 2 indistinguishable-looking beverages, one standard sugar-sweetened, and the other artificially sweetened, without sugar. And they gave them to these children over the course of 18 months. And they found that the kids who were drinking the artificially sweetened beverage in the open circles, their BMI didn't change at a time when it would normally be going up, whereas the ones who got the sugary beverage kept going up. And that difference amounted to about 1 kilogram, about a little over 2 pounds. Doesn't sound like so much, but if that effect persists year after year, we're talking a huge population effect. And in our randomized controlled trial, we delivered non-sugary beverages to a intervention group, and that included either water, flavored waters or artificially sweetened waters to replace sugary beverages. So one group just kept drinking the sugary beverages and the other group got the replacement. And we found that after 1 year, so that was the active phase of the study on the left of this figure, again, we could basically eliminate in that red the increase in BMI that occurs at this age, whereas the sugary beverage consumers kept gaining BMI. That difference in this case was 2 kilograms. After we stopped the intervention, that effect washed out. It kind of makes sense, you know? If you're going to have a benefit, like 1 year off of sugary beverages doesn't protect you for life. You know, you need to stay off it. And then lastly, I want to just comment on some inconsistencies in the literature. This study from Vartanian and others looked at 88 studies of sugary beverages and health that were published in the world's literature. And they found that overall these studies demonstrated a strong relationship between sugar-sweetened beverage consumption and increasing body weight, diabetes risk, and other health outcomes. But the waters sort of separated as if in front of Moses. Those that were funded by the food industry showed little to no effect. And those that were independently funded showed a big effect. So we have to also understand that this isn't, and this isn't to say that the food industry supported studies done by scientists are, you know, intentionally skewing the data, but bias can creep in a lot of stages. And the food industry, and especially the beverage industry, has been motivated to fund these studies because there's a demonstrable threat to their business interests. And we have to ask whether these food industry-supported studies are really rigorous science or a form of marketing. So in summary, there are many ways that we can think for understanding why sugary beverages stands out among all other food classes, some healthy, some less healthy. But this one, why is this the low-hanging fruit? We can think of a variety of plausible reasons why it should be worse than all other categories. The observational studies provide supportive evidence of this. The randomized controlled trials get us pretty close to cause and effect proof. And the variability in the literature, which has been used by the food industry to undermine taxes and other restrictions. You know, that variability is likely contributed largely by, well, there's always some, you know, variability in research findings. It's the nature of clinical research in humans. But a lot of that variability is attributable to funding source. So I think we can make a strong case that the data support public health interventions, such as awareness campaigns, regulations on advertising and marketing to kids, calls to renounce celebrity endorsements, restricted availability in schools. And all of these have been done, you know, leaving taxes. They've been done, and they are having effect. During the 70s and 80s, during that low-fat craze, even sugary beverages were touted as healthy because they were fat-free. It's true. And sugary beverages consumption skyrocketed as milk consumption came down. But since about 2002, with increasing awareness of sugary beverages and health risks, consumption is starting to decline, but it's still at historically high levels, which is why we need stronger measures like a tax. And we have experience with what these taxes can do. In Berkeley, 1 year following implementation of this was the nation's first large sugary beverage tax, the prices of sugary beverages increased as intended, sales declined, and the sales of untaxed beverages rose. You know, so the merchants are kind of coming out as a wash. These declines occurred even in affluent communities, suggesting that lower income communities, which are especially vulnerable to these adverse effects, will have even greater outcomes. In Mexico, the tax, this is the first nationwide tax on sugary beverages, was associated with reductions in purchases of the taxed beverages and increases in purchases of the untaxed beverages. So same finding. after the tax went into effect, sugary beverages decreased by 6%, and other beverages went up by 12%. Researchers projected that a 10% reduction among Mexican adults would save almost would prevent about 200,000 fewer cases of type 2 diabetes, with an anticipated savings of $1 billion in Mexico. And then lastly, we come to Massachusetts. This is the opportunity to create the first statewide tax in the United States that is based on a tiered system linked to sugar content, which is really a key innovation here. It would place Massachusetts where it should be, in the forefront of public health. The benefits are reducing sugar and sugar-sweetened beverage consumption in children and adults. The massive long-term health savings. We have such a progressive system of health reimbursement and support for low income, and those costs fall to the public. Let's make the system even more sustainable by reducing chronic disease, diet-related chronic disease, which is the main driver of diabetes and heart disease today. And lastly, the revenue generation. And finally, I want to point out that there are legitimate concerns about the regressive nature, potentially regressive nature of a sugar-sweetened beverage tax, that it would hit low-income communities the hardest. Those are the communities hit hardest by diet-related disease. And the regressivity can be reversed, ameliorated, by earmarking those taxes to benefit the communities that wind up paying the most taxes. Thank you for your attention.
So next, we're very pleased and delighted to welcome folks from the Boston Bruins Foundation. Many people may not be aware of the terrific work that the Bruins do, working in our communities with schools, with fire departments, and others around health and wellness programs targeted at our kids, specifically the BFIT initiative. So we're going to be hearing from Bob Sweeney, as I mentioned earlier, is the executive director of the Bruins Foundation and also a former NHL player, as well as John Whitesides, and John is the strength and conditioning coach for the Bruins. So I think we're going to hear from Bob first. All right, welcome. You're together.
Thank you, Senator. So we're here today to talk about a program that we came up with that John during our lockouts in 2004 and 2013 was very passionate about health and working out, and did a lot with the firefighters near our old practice facility in Wilmington. And this program that we developed called BFIT was really John's work over a long period of time. And John was our strength coach for 15 years, and he's in his first year now working with the foundation and working with myself. And we've really tried to make a lot of differences in the schools with kids. It's something that we find has been a great success. John puts the kids through different programs. He tells them about, working out and staying active. And it's something that, not only yesterday I was in a school in Haverhill talking about a STEM program that we do a lot of work with our schools, academically, but we're trying to build on that and give them a little guidance in making sure they're working out and doing all the right things to stay as healthy as possible. So I'll just turn it over to John, because he really is the brainchild of this initiative, and he can talk a little bit about our school assembly programs and what we've done with our police and fire and all the other good stuff. So John.
Thanks, Bob. Thanks, Senator Lewis. Senator Lewis was involved with the BFIT program in the early concept. We met at campaign headquarters over in Winchester early in, I'd say, mid-October. So I was talking a lot of hypothetics at that point in what we were going to be able to do with the BFIT program, and having a great platform like the Boston Bruins to spring a program like this really raised the level of it, and it really raised quickly. We opened up with our kickoff program, which was the First Responder Challenge at TD Garden. The program raised $130,000 for the 100 Club of Massachusetts, which take care of people's families that have been killed in the line of duty. And then after that, we went into the schools, which was a terrific success that we've had. We've been able to go in, and we started trying to get everybody moving in the school. When we go in there, and we realized that when you get into a school of 900 to 1,000 kids, it was extremely hard to control them. So we turned it in a little bit more of a show. We bring out teachers, we bring out kids, we get them moving, we talk about health, we talk about wellness. And as the doctor was saying, the big thing we think is that Massachusetts should be a leader in health and wellness. There's no question about it. With all the hospitals here in Massachusetts, specifically in Boston, you know, everybody's on the cutting edge of health and wellness in Massachusetts. So I know Senator Lewis is very passionate about health and wellness, as are we here with the Boston Bruins. And our big goal with the Boston Bruins Foundation is to make the kids of Massachusetts healthier. Thank you.